How to treat and cure multiple sclerosis. There is no cure for multiple sclerosis. Treatment typically focuses on speeding recovery from attacks, slowing the progression of the disease and managing MS symptoms. Some people have such mild symptoms that no treatment is necessary. Treatments for MS attacks. Corticosteroids, such as oral prednisone and intravenous methylprednisolone, are prescribed to reduce nerve inflammation. Side effects may include insomnia, increased blood pressure, mood swings and fluid retention. Plasma exchange. The liquid portion of part of your blood is removed and separated from your blood cells. The blood cells are then mixed with a protein solution and put back into your body. Plasma exchange may be used if your symptoms are new, severe and haven't responded to steroids. Treatments to modify progression. No therapies have shown benefit for slowing the progression of primary progressive MS. For relapsing remitting MS, several disease-modifying therapies are available. Much of the immune response associated with MS occurs in the early stages of the disease. Aggressive treatment with these medications as early as possible can lower the relapse rate and slow the formation of new lesions. Many of the disease-modifying therapies used to treat MS carry significant health risks. Selecting the right therapy for you will depend on careful consideration of many factors, including duration and severity of disease, effectiveness of previous MS treatments, other health issues, cost, and childbearing status. Treatment options for relapsing remitting MS include beta interferons. These medications are among the most commonly prescribed medications to treat MS. They are injected under the skin or into muscle and can reduce the frequency and severity of relapses. Side effects of beta interferons may include flu-like symptoms and injection site reactions. You'll need blood tests to monitor your liver enzymes because liver damage is a possible side effect of interferon use. People taking interferons may develop neutralizing antibodies that can reduce drug effectiveness. You'll need to have your heart rate monitored for 6 hours after the first dose because your heartbeat may be slowed. Other side effects include headache, high blood pressure and blurred vision. Treatment with alemtuzumab involves 5 consecutive days of drug infusions followed by another 3 days of infusions a year later. Infusion reactions are common with alemtuzumab. The drug is only available from registered providers, and people treated with the drug must be registered in a special drug safety monitoring program. Mitoxantrone. This immunosuppressant drug can be harmful to the heart and is associated with development of blood cancers. As a result, its use in treating MS is extremely limited. Mitoxantrone is usually used only to treat severe, advanced MS. Treatments for MS signs and symptoms. Physical therapy session. Physical therapy. A physical or occupational therapist can teach you stretching and strengthening exercises and show you how to use devices to make it easier to perform daily tasks. Physical therapy along with the use of a mobility aid when necessary can also help manage leg weakness and other gait problems often associated with MS. Muscle relaxants. You may experience painful or uncontrollable muscle stiffness or spasms, particularly in your legs. Muscle relaxants such as baclofen, Lorasil, and tizanidine may help. Medications to reduce fatigue. Other medications. Medications also may be prescribed for depression, pain, sexual dysfunction, and bladder or bowel control problems that are associated with MS. Alternative medicine. Many people with MS use a variety of alternative or complementary treatments or both to help manage their symptoms, such as fatigue and muscle pain. Activities such as exercise, meditation, yoga, massage, eating a healthier diet, acupuncture and relaxation techniques may help boost overall mental and physical well-being, but there are few studies to back up their use in managing symptoms of MS. Guidelines from the American Academy of Neurology recommend the use of oral cannabis extract for muscle spasticity and pain, but do not recommend cannabis in any other form for other MS symptoms due to a lack of evidence. The guidelines also do not recommend the use of herbal supplements such as ginkgo biloba and bee venom or magnetic therapy for MS symptoms. Treatment and care. Medications can help ease MS attacks and possibly slow the disease. Physical therapy and other treatments help control symptoms and improve your quality of life. Treatment. Multiple sclerosis treatment. There's hope for MS, with several drugs that can help slow the disease. Read more about disease-modifying drugs. MS medications. Medications used to treat MS. Deep brain stimulation, multiple sclerosis tremors. This surgical procedure is effective in controlling tremors, but it has risks. Read this brief overview. Plasma exchange for MS. Plasma exchange, also called plasmapheresis, is one possible treatment for MS. Read more about this option. Controlling muscle spasms. Muscle spasms and stiffness are triggered by many factors. This overview explains what's happening, and what helps. Click here. Managing bladder control problems. Embarrassing bladder problems are common, and they can be solved. Learn to regain control of your bladder. Click here. Alternative treatments for multiple sclerosis. Certain interventions could relieve MS symptoms and improve quality of life. Read more about the alternative options. Riskier alternative treatments for MS. While some alternative treatments do provide relief from MS symptoms, there are others that you may want to avoid. Read more about the riskier and unproven alternative treatments. Ampera for MS. Ampera, dalfampridine, is a new and different treatment option for MS. Treating MS with interferon drugs. Interferon beta drugs are similar to proteins produced by the body for the immune system. Read more about this kind of MS treatment. Cytoxin therapy for MS. Cytoxin suppresses the immune system, which slows MS progression. Find out more about this therapy. Amoran for MS. Amoran, azathioprine, is another drug used to slow the progression of MS by suppressing immunity. Click to read more. Treating MS with a baclofen pump. Baclofen is a common treatment for spasticity associated with neurological diseases. A pump system can reduce side effects of the medicine for long-term use of the medicine. Learn more. Botox for MS. Botox, botulinum toxin, relaxes muscles and reduces spasticity. Find out how it works. Noventrone for MS. Noventrone, mitoxantrone 4, is an immune-suppressing medicine that can only be given via N4. Read more about this therapy for MS. Treating MS with 4 steroids. Potent 4 steroids are sometimes used to reduce and control the symptoms of an acute attack of multiple sclerosis. Find out how doctors use this medicine to ease relapse symptoms. Tysabri therapy for multiple sclerosis. Tysabri, natalizumab, is a treatment option to delay the progression of MS and reduce flare-ups. Find out more about this drug. Alternatives and pain relief. Acupuncture and other alternatives can relieve pain. Read the exciting research. Care. Multiple sclerosis doctors and therapists. Multiple sclerosis is a complex condition, so several specialists will be involved in your care. Click here to meet your healthcare team. Physical therapy and multiple sclerosis. With physical therapy, your quality of life can improve. Learn the benefits of physical therapy. Click here. Therapy and multiple sclerosis. Your everyday life can be easier and more productive with an occupational therapist's help. Click here to learn more. Heat and multiple sclerosis. Hot climates can worsen your MS symptoms, but you can gain control. Learn what to do. Managing bowel problems. As the body changes with MS, so does bowel control. These tips will help you deal with incontinence, diarrhea, and constipation. Click here. Managing speech and swallowing problems. Damaged nerves can cause these problems. Speech therapy techniques can help. Click here to learn more. Treating multiple sclerosis pain. Most MS-related pain can be treated, but it's not as simple as taking an aspirin. Click here to read about pain treatments.